Hello, Nigel. Welcome to the program.
Thank you. I'm excited to be here, but I have to say, is it tiring? You look kind of tired. Is it going to drag me down?
Yeah, I thought we were going to go there.
Right.
Yeah. Well, how old are you? 21. Yeah. But I do. Look at you. I do feel a little bit older. I just turned 50 this year.
Oh, wow! Congratulations.
And I
don't look a day over 49.
Thank you. And I was, I know we do a lot of aesthetic projects.
Course, yeah, absolutely.
And I know you're involved with some of those. Maybe we could talk a little bit about.
Oh, yeah, that's right. And it's like the perfect kind of drug delivery kind of thing because obviously the goal is to get the Botox in the right places.
Right.
And so how do you get there? Well, you might think it's kind of complicated, but most of the time it's just a regular old syringe, and it kind of blends the that art and science kind of method. And so you have a practitioner with a standard syringe, and they're looking for those perfect spots to apply the Botox often in the face. And it's tricky because if you get the wrong muscle, you can cause the wrong effect. You have to actually know which maybe muscles or tendons, will create the desired outcome, even though they're maybe not next to the place you're looking for. Maybe they're a little bit farther away. And which ones cause which facial expressions. Faces are actually quite complicated, as you might know. What is it? 25 ways to smile and only 55 muscles to frown.
Right.
Yeah,
exactly.
something like that. And patients are moving, and the drug is actually super expensive. So it's quite interesting. Learning for me was just how complicated this practice is, and how some people are have these really strong relationships with their clients because they know exactly what the client needs and they're quite good at it. And and it's quite a variance in that too. Even though the drug is essentially the same, basically no matter where you go. It's the same idea.
Yeah, so that's something that's always interests me, as a microbiologist, right? Yeah. I'm familiar, of course, with Clostridium botulinum, which is the...
What's that?
Well, that's the organism, of course, that produces the botulinum toxin, right?
Is that Botox?
That's Botox.
Cool.
And, it fascinates me. And it's pretty toxic stuff. 1 microgram can kill you, right?
Wow.
And so, it talks to, your interface, right, where you're trying to apply it in the right spot, getting the right concentration, the right dose, like we do with a lot of our other drug delivery programs, getting the right dose, the right time. And I remember hearing that there's an expression that they have in the aesthetic community. What is that?
That's right. Yeah, when you're working around the face, there are actually quite a number of blood vessels, and so something I heard was the you bruise them, you lose them. And so you got to imagine that if you're going in there to get a bit of a touch up, make yourself maybe feel a little bit better, add a little confidence to your life, and you leave with a big bruise on your forehead, you might find a different practitioner. So you can see how kind of complicated the drug delivery is with the actual patient experience.
Fascinating. Well, I'll remember that day. If you bruise them, you lose them.
Bruise them, you lose them.